Welcome back. Well, many of us might think we know what a heart attack looks like, where you clutch your chest in pain, like the old Sanford and Son. I'm coming home. I'm coming home.
You know, that's what it looks like in the movies. Yeah, you're grabbing your chest. But heart attacks don't always stick to the script, and symptoms can look very different for men and women as well. And joining us today, we have Sanford cardiologist Dr. Kassem here to talk a little bit about what we should be watching out for. And I kind of want to start just with what is happening exactly when someone has a heart attack.
So when someone has a heart attack, it means that the blood supply to an area of the heart or heart muscles is suddenly blocked. You know, it could be sudden blockage of the blood flow resulting in the heart muscles not functioning the way how it should be.
So we talked right away about, you know, clutching your chest and, you know, the very dramatic signs. Are there other signs or symptoms that you could maybe watch out for that could be leading up to a heart attack that aren't maybe as well known to people?
Yep, you know, usually the heart attack, it's not unique for each and every person. So there is, but still there are some definitive set of symptoms which you should always watch out for. So the most common being like some kind of a chest pressure or a heaviness or kind of a fullness in the chest. And sometimes you also feel not feeling well, like fatigued or being short of breath. And there are other different kind of symptoms which you usually don't think about it, but then we always have to keep that in mind. For example, the heart racing faster, or you say that, like, you know, I think I had a pizza last night and I'm feeling some kind of indigestion today and I'm not feeling well. So anything which is out of the ordinary related to chest pressure, shortness of breath, or sometimes the pain can even just be in the arm or shoulder or between the shoulder blades or even in the back. So any of these kind of non-specific symptoms, you should always think about heart attack.
So at what point do you either drive yourself to the hospital or call 911? I mean, how serious should it be?
Usually, you know, as I said, these things can happen even in our day-to-day lives. But sometimes if you feel that this is out of the ordinary and you feel things are not right, or if these kind of chest pressures are more severe than what you experience usually, then that's a red flag. So then I would say, don't waste time, come to the hospital. I would say, don't drive. You know, you can let somebody else drive or call 911, you know, if you think the symptoms are not very good, you know. So if it's serious, if you think that, just call 911. That's the best thing to do.
Are there differences in the symptoms and how between men and women?
Yeah, you know, classic 50% of the time it's chest pain. But then there are some other times when the symptoms are different. That's more common in women, those uncommon symptoms. So as I said, that feeling of fatigue or more of a indigestion or stomach pain, fullness, not the classic elephant chest sitting on the chest feeling. It's more different kind of feeling, or more shortness of breath or palpitations. And, you know, sadly, these kind of atypical symptoms, these are usually taken lightly by the patients, and that causes delay in the presentation. As you know, time is muscle, so every second counts. So, you know, so it's important to accurately identify these symptoms and come to the hospital immediately.
Sometimes I feel like when you said when there are different symptoms, people think I'm just having an anxiety attack or I'm feeling not quite right. Is that the delay and the confusion as well?
Yeah, you know, as I said, you know, most of the time patients attribute these to some other light things, you know, like I had some Coke or maybe some food, or I did some heavy work yesterday, maybe it's a muscle pull, and you attribute it to that. That's the most common problem we encounter with the delay, you know. So, you know, it's hard to say, but, you know, like in this thing, you don't have any, you know, like false alarm. If you have something, you just come in. That's what we have to say.
Better safe than sorry,
Yeah.
for sure.
Yeah.
And I want to ask, I know a reporter we used to have here at the station, and I followed her. She is, you know, because of Facebook, you can follow everyone. She's only in her 30s, and she had a heart attack. I feel like it's not the typical, you know, people you think anymore. You don't have to necessarily always be older and overweight and have all the signs. It seems like we're seeing different reasons as well.
You know, the heart attack can be from, you know, the plaque buildup, or it could also be from something called a spasm where the heart blood vessels go into spasm, and those can happen in younger people. And you could see that as part of a heart attack, or even in patients who have a very strong family history, with multiple family members having heart attack in their younger ages. Then you have to always keep this in mind, even if the patient is younger.
So if I'm an onlooker and I see someone that I think might be experiencing a heart attack, obviously I'm assuming call 911. Anything else I can do to help?
You know, the most important thing at that time is early coming to the hospital, you know, just not delaying the diagnosis. Let us take care of it, you know, like there's no like false sheep or anything like that, so you can always come in right away. That's what I would do, you know, better be safe than, yeah.
And before we go, I mean, preventing heart disease and heart attacks as well, it's important to have your checkups and any questions in advance, talk to your physician as well, correct?
That's true. So, you know, sometimes there are new studies which are coming out. They say, you know, like you can see some kind of atypical, some symptoms even a month before.
Wow.
You know, you can have fatigue, you can have small recurrent chest pains which last for a few minutes and then goes away. And you know, if you see that as a pattern happening for a few weeks, then you should always be worried about a possible heart attack which can happen. You know.
And the best way to mitigate heart attacks is just to go to the Maldives, right? So thank you for being here, Doc. Anything else you want to add?
Thank you. No, thank you.
All
Thank
right.
you.
Coming up, whether you are renewing vows or set to be a brand new bride, the wedding show's got everything you need to be prepared.